name is Angela Enzina. It is Thursday, September 26th at 6:17 p.m. We are doing the trach suctioning on Gus. This is Gus. Okay, so first I have my supplies. Okay, I'm gonna do hand hygiene and then ID Gus. So if he's able to ID, if he's able to talk, ask him his name, date of birth, check his wristband, check the computer. If not, if anybody's with them, we can talk to them, check the band, check the computer, check if there's any other thing in the room, ID on the door. That way we know we have the correct patient. If the patient is in a single room, we would close the door. If he is in a double room, we would close the curtain. So, to give him as much privacy as possible. Then whether the patient is alert or unconscious, we would explain to him what we're doing. So we're going to be suctioning the trach due to some congestion, or if he complains about it, we would check it against the order, make sure we have it. We would check for the suction against the order to see what we need to set the suction at. But we know that for a full-size adult, we don't set it above 150. If he's in pain and can tell me he's in pain, we would provide pain meds and then come back 30 minutes to an hour for those pain meds to kick in before we start the suctioning. If not, we can go by nonverbal cues if he's in pain, and we can provide that. If we don't know and he's not giving any clues, we can check the chart to see if he's been getting pain meds before each suctioning or not. Then the next thing you want to do is adjust the patient to make sure he is in the correct position for the suctioning. For an alert patient, you want him up in semi-Fowlers. For a non-alert patient, you want him in a lateral position to you. I'm on my dining room table, so we cannot go up, down, or anything like that, so we're just gonna pretend. And then to get started, you want to, have your supplies. So you're going to take your waterproof sheet and place it over his chest. You don't want any of the secretions to get on him as least as possible. Things happen, sometimes it happens. The best way to do it is to tuck it in to the shirt, if he is wearing a shirt, into the gown. That way while you're moving around, it moves as least as possible. And then you want to check the suction, make sure the suction is suctioning, that is attached to the wall or the portable suction machine that you do have. And then we're going to go ahead and get started. When you check the suction, you want to check it with gloves, not with a clean set of gloves, not sterile gloves, no bare hands. Everything's always done with gloves with patients and with whatever we're doing to the patients. So next we're going to open our sterile package. This is already open, pretend it's not. That way, we're in a sterile field. So you're going to take it out of the package, clean your hands, take it out of the package, and then you want to open the package from the outside, making sure not to touch anything on the inside. Although we do have to grab the saline box out of it, we want to touch the outer edge of the box without touching anything else in there. So this is the box that we're going to fill with saline. It just pops open. You're going to put it down and you're going to fill it with your saline that you're going to have in a little canister. Some of these kits come with it, some of them do not. If it does not, make sure you grab that before you start the suctioning. And then you're going to put on your sterile gloves. You want to touch the outer side with as least as possible, not to contaminate it. So then you're going to have a sterile hand and a dirty hand. Dominant hand, I'm right-handed, that's going to be my sterile hand, and this will be my dirty hand. This is the hand that's going to work the Y tube and the ambu bag to hyperventilate and take the ventilation off if there is any ventilation on the patient in between suctionings. So you're going to grab the catheter and pretend this is already hooked up. This is the Y port that is hooked up to the suction in the machine that's in the wall or portable. This is your Y port that you hold it, it creates the suction. So this is what you're gonna operate. So first you want to take off any ventilation and have the bag to hyperventilate to the patient. You wanna, suck up some sterile saline to make sure it works and to lubricate it. And you're gonna take it off, ambu bag, you're gonna hyperventilate. Once you take that off, you wanna stick this in quickly as to not to create least discomfort. And then on the way out, you want to intermittent your Y port right here with the suctioning. While you're doing that, you're twisting, so it's gonna go in a twisting motion, not that big because the catheter's not, or the trache's not that big, but you're gonna do a suctioning, twisting motion, intermittent, while you're on your way out. You're gonna replace the O2, you're gonna hyperventilate him again with the bag and replace the O2. You wanna reassess at this point. Do you think the patient needs more suctioning? If yes, you have to wait at least 30 seconds. If he needs another pass at suctioning, you wanna make sure you don't go above 3 passes while you do the suctioning in one suctioning episode. If he does not need any more suctioning, then you're good to go. So now you wanna clean the catheter and you wanna pay attention to the mouth. Does the mouth need suctioning? So we're gonna suction the mouth, as best as we can that way. Once you insert this into the mouth, you do not want to put it back into the trach because then it's cross-contamination. You can get a lot of bacteria that way. You'd have to get a whole new one. All right. So 3 passes through the trach, no more than that. Swirling motion on the way out with the intermittent suction. Once you're done that, you want to suction the mouth. Okay. Now, once we're done with all of our suctioning, we want to perform any other oral hygiene. Do they have swabs? You want to swab the mouth out, get a little moist in the mouth. We want to swab that out and clean it. Now, we are all done with this. So it's going to get coiled up in the hand, and you're going to take your glove off, and it's going to remain in the hand. So it's going to go this way, and then we'll just take off this glove this way. And everything's right in the glove. When you're done with that, before you walk away, you want to raise the bed rails, put him in a position that's comfortable for him if he is able to tell you, or the previous position that he was in before, if he cannot tell you, and turn off the suction. Once the suction is turned off, now we got this whole thing to clean up. You do not want to touch anything without gloves. So we would get another pack of gloves, just clean gloves is fine. Put those on and clean up all of this. This would then go into the trash. After that, any remove, you can either wash your hands or sanitize your hands, and you want to, either way wash them. After that, you want to come back to the patient and you want to reassess him. How does his lung sound? Does it seem like he's either easier to breathe? Do you feel like he's going to need more suctioning in a little bit? If so, you want to explain that to the patient. I think you're good to go. If you feel any discomfort or, you feel like you need more suctioning later, come and get me and we can, do this again. But you want to make sure you don't go above what the orders say. If the orders have a certain amount of time in between suctionings, the 3 pass suctioning that each episode, then you want to follow that. If he feels like he needs more, then be like, I can come back in a couple hours. If it's sooner than that, then just go talk to the doctor and get another order. But that is trach suctioning.